We designed HELPcare Clinic to solve some of the most important problems facing U.S. healthcare today. It's unaffordable, it's impersonal, and it's ineffective. I probably don't need to take a whole lot of time convincing you that the U.S. healthcare system is unaffordable. But to illustrate it, here is a bill we received for 3 lab tests my wife Lisa had when I worked at Mayo Clinic, and for those 3 lab tests and the blood draw, the charge was $504. We were responsible for all of it as part of our deductible, even though we had very good health insurance. And of course, health insurance has become extremely expensive as well. Many people also find the current healthcare system impersonal. It often feels hurried and industrial, and with 15-minute office visits, there isn't time to address underlying causes of the symptoms they're experiencing. They don't have a provider they know and who knows them. Finally, the U.S. healthcare system is ineffective. If you're going to measure the effectiveness of a healthcare system, probably the best indicator would be life expectancy. And in the last few years, U.S. life expectancy has actually gone down for the first time in decades. So in addition to the metabolic health coaching we offer through HELPcare Clinic providers take time to understand their patients to help them find underlying causes of disease. Because HELPcare Clinic doesn't take insurance of any kind, overhead costs are lower, and you don't have a third party between you and your provider. HELPcare Clinic has an affordable membership model that includes a surprising range of services in its monthly or annual dues. Remember the 3 tests that Lisa had that were $504? All of them and about 50 more are included at no additional charge as needed with HELPcare Clinic membership. At HELPcare Clinic, there also is no per visit charge for your provider appointments. The standard appointment length is an hour, and if you don't get to cover all of your concerns, you can book a follow-up at no extra cost. And many generic prescription drugs are included in your membership too. The feel we're trying to create at HELPcare Clinic is Norman Rockwell meets the Jetsons. We want to have the personal touch as captured in the old Norman Rockwell paintings of a country doctor interacting with patients, and yet use the latest technology when it's beneficial. The Norman Rockwell part of the equation comes from the people who work at HELPcare Clinic, starting with our providers, Dr. Dave Strobel and nurse practitioner Stephanie Kimmis. We also have a wonderful cadre of nurses who help Dr. Dave and Stephanie provide outstanding care and service to HELPcare Clinic members. And finally, our administrative staff from HELPcare is here to handle the scheduling and membership management, as well as making sure the providers and nurses have all the supplies and equipment they need to care for members. So the team has grown significantly in the last 6 months as membership has increased. And starting in September, HELPcare Clinic will have scheduled appointments every day, Monday through Friday, as well as Saturday mornings. The Jetsons part of HELPcare Clinic comes from our use of technology, from basic lab tests that can be done right in the clinic to the complicated tests we send out to LabCorp. We also have the InBody to measure body composition to help members set meaningful health goals in terms of gaining lean muscle mass if necessary and also losing body fat. And finally, HELPcare Clinic is the only primary care practice in Minnesota that offers FibroScan to measure both fatty liver and liver fibrosis. This is serious space-age Jetsons technology. All of this is very affordable. Memberships are $149 a month for a single person, $249 a month for a couple, and $349 a month for a family. If you join by August 31st, you can save $20 a month on any of these memberships for as long as you stay a member. And we also offer a corporate membership plan which enables employers to contribute toward HELPcare Clinic memberships for their employees and their families, even if they can't afford to support a traditional health insurance benefit. HELPcare Clinic membership will cover most of your healthcare needs for most of your life, but it doesn't cover everything. HELPcare Clinic is primary care, so when hospital or other specialized services are needed, our providers can refer patients elsewhere. Sometimes that means our administrative team searches for the best self-pay prices, especially for our members who don't have health insurance. It always means that we work with the patients to find the services they need, including referrals to Mayo Clinic for serious and complex conditions. And excellent primary care can help expedite that referral process. I unintentionally became a case study for this just in the last couple weeks. I'd been having back and neck pain for about 3 months, and based on some worsening symptoms, Dr. Dave suggested I get an MRI of my cervical spine. Because I paid for this directly instead of using my insurance, we were able to get this done for just a few $100s at a Twin Cities imaging provider. That was on Tuesday, July 19th, just over 2 weeks ago. That afternoon, Dr. Dave read the report and said I needed to be evaluated for spine surgery because I had a herniated disc putting pressure on my spinal cord. Wednesday morning, Dr. Dave initiated the referral, and later that afternoon, I took my CD with the MRI images to the emergency department at Mayo Clinic in Rochester. I was evaluated there, and because I had the images, they could see right away that I needed an operation. Within a couple of hours, I was scheduled for surgery that following day. And the following day, Friday, July 22nd, I got to see the x-rays of the surgeon's handiwork and was headed home with Lisa. I'm grateful for and proud of my career experience at Mayo Clinic, and now I'm grateful for an outstanding patient experience there. I think my experience illustrates how direct primary care, like at HELPcare Clinic, can work really well with the established healthcare system, providing cost-effective day-to-day care and then getting to see the top specialists when you really need them.